Processing is a process. The ins and outs of piglet processing. What is the importance of processing? There are many different management practices that must be performed in the swine industry. One of the most critical management practices is the processing of the piglets a couple of days after birth. There are a variety of processing procedures amongst different swine operations, but most commonly include castration, clipping needle teeth, tail docking, ear notching, and iron injections. Processing should include castration, clipping needle teeth, tail docking, ear notching, and iron injections. Usually processing occurs between 1 to 14 days old, but should typically be done within the first 3 days of life. Processing within the first couple of days of life is critical to lowering the amount of stress put on the litter. Castration. There are many benefits for castrating the male piglets, but mainly castration is to make management of the piglets easier as well as to prevent boar taint, which affects meat's acceptability with consumers. There are various methods of castration. Materials required: surgical blade and handle, antiseptic solution, cotton wool, and iodine spray. Procedures for castrating your piglet. One person hold the piglet between the legs with the testicles presented, or a stand may be used. Raise the testicles to the surface using the thumb and index fingers. Using cotton wool with antiseptic, wipe the outside of the testicles. Use the scalpel to make 2 small incisions, one on each testicle. Pull the testicles out with a swift tug, or you may also pull them out and cut them away. If there are any strings left behind, cut them away. Spray with iodine. No sutures are needed. Clipping needle teeth. Pigs are born with 8 needle teeth, which need to be clipped when processing your litter. The main reasons for clipping the piglet's needle teeth is to protect the sow's underbelly and from hurting other litter mates. Materials required: sharp pair of side scissors or cutters and a small container of antiseptic. Procedures for clipping needle teeth. Wash cutters in hot soapy water and disinfectant before use. Check blades for damage. If evident, use another instrument. Always have a spare on hand. Hold each piglet with the 3rd finger placed in the angle of the jaw and the 4th finger across the trachea to suppress squealing. Place the clippers parallel to the jawbone and clip. Do not point the clippers into the gum. Make sure there are not sharp points left. Clean clippers in preparation for the next piglet. Tail docking. Tail docking is another very important part of processing. Tail docking is done to prevent tail biting, which can cause infections, which can lead to more serious issues and can even lead to carcass condemnations at slaughter. Caution: you do not want to clip the tail too close to the body because this can cause damage to the muscles that support the anus and vulva. By cutting the tail too close to the body, this can cause prolapse. Make sure the tail isn't left too long though, because tail biting will occur. Materials required: sharp pair of side cutters or scissors and a small container of disinfectant. Procedures for tail docking. Wash tools in hot soapy water and disinfectant. Place the tail at desired length and remove tail with a clean, quick cut. Then place the stub of the tail in a sterilized solution. Make sure to place tools and disinfectant when they are not being used. Before placing the piglets back in the pen, make sure bleeding has stopped. Ear notching. Identification is key for management purposes. There are many different types of identification that you can perform, such as ear notching, tattooing, implants, tagging, etc. Ear notching. Use a sterilized ear notching tool and make the notches in the appropriate locations on the ears depending upon the system used. Iron injections. Iron is not transferred from the sow to the piglets during the prenatal period. Therefore, they are born with low iron deposit. When the piglets are on the sow, their milk has little iron and needs to be supplemented to anemia. Iron can either be orally given or given through an injection. Injection is preferred way to supplement the iron because it is easy to regulate the dosage and ensure the piglets can get all the iron needed. Materials required: iron dextran needles, syringes, automatic syringe that will administer 1 to 2 milliliters. Procedures for iron injections. Fill the syringe with iron solution. Raise the pig by back legs and hold. Administer iron injection slightly behind the ear intramuscularly and inject 1 to 2 milliliters. Works cited.